Good afternoon, Dr. Sonia.
Good afternoon, sir.
Please start your topic. Thank you.
My topic for the day is dental implant. I'll be briefly talking about implant. Why is it used? What it is? What are the advantages, disadvantages, the risk involved? I go on. So what is dental implant? Dental implant is an artificial titanium fixture. It is similar to those used in orthopedics, which is placed surgically into the jawbone to substitute for a missing tooth and its roots. The alternative solutions are partial and full dentures, crowns, bridges, when we are not using dental implants. So the history of dental implant goes way back in 1952 when Professor Per-Ingvar Brännmark, he was a Swedish surgeon, while conducting research into the healing patterns of bone tissue, accidentally discovered that when pure titanium comes in direct contact with the living bone tissue, they two literally grow together to form a biological adhesion. And he named this phenomenon osteointegration. So what are these implants made of? Implants are made up of titanium screw, which are usually grades from 1 to 4, but sometimes 5 also. Titanium is widely used because it's a stronger material and it can support the restoration after the procedure. Now these are some implants used, screw implants and cylindrical implants. The biomaterial used are titanium, zirconium, hydroxyapatite. Now this titanium is widely used. Why? Because it is lightweight, biocompatible, corrosion resistant, strong and low priced. Now there are three different types of implants. First is the endosteal. Now during this endosteal, the gum is opened up, a hole is drilled within the bone, titanium screws and cylindricals are then inserted within the jawbone, and once the bone has healed, the teeth can be secured in place. The second one is SUBPERIOSTEAL. This is less common. Screws are placed on top of the bone, but under the gum line. This method is typically used for patients who have minimal bone height and are unable or unwilling to wear dentures. Third is the transosteal. This is even less used because the drilling completely through the lower jaw, then bolting a metal plate into the bottom of the mouth, the titanium then goes through the bone, skin under the chin is opened, resulting in scarring, and this is high failure rate because of the scarring. So some of the indications are of implants. It increases the support, stability, patient satisfaction. It increases the patient's comfort in chewing. It increases the confidence in smiling and speaking. It increases the patient's overall psychological health and replaces one or more teeth as single units with crowns. And it has good aesthetics, provides good support for partial denture as well, and in root canal failures also, it can be used. And adults who are developing premature wrinkles or sunken-in cheeks due to missing teeth, there also implants can be used. So the procedure of implants goes in 3 phases. In all these 3 phases, it is done under local anesthesia. The first surgical phase is that the dentist places dental implants into the jawbone with a very precise surgical procedure. Now the implant remains covered by gum tissue while fusing to the jawbone. In the second surgical phase, approximately after 6 months of healing, under the local anesthesia again, the implant root is exposed and a healing post is placed over the top of it so that the gum tissue heals around the post. Third, that is the prosthetic phase. Once the gums have healed, an implant crown is fabricated and screwed down to the implant. So there are some preliminary evaluations done for implants. First is the psychological evaluation. The dentist assesses the patient's attitude, ability to cooperate during complex procedures, and overall outlook on dental treatment. Second is the dental evaluation is done, in which the dentist evaluates the condition of the teeth, the soft tissues, the areas attached, unattached tissue, the height, width of the edentulous alveolar bone ridge. Then is the medical evaluation, in which he assesses any existing medical conditions that could worsen as a result of the stress of implant surgery. And there are some radiographs also done. Contraindications are, though the financial investment is quite high, the treatment can take up to 9 months. There is a risk of infection and other complications as well. An implant may loosen and require replacement. Implant procedures may be challenging for some patients. Bruxism is a significant component of failed implants in which there is constant grinding of teeth. So the patients with certain medical complications should not have implants. Now, the advantages and disadvantages of implant over conventional treatment. Conventional treatment is the crowns, the bridges, the partial dentures. Now, how are the advantages? Implants do not involve any preparation of adjacent teeth. They preserve the residual bone. Their excellent aesthetics can be achieved. However, it is expensive, patient requires surgery, it is time-consuming and technically complex. The risks involved are the infection at or around the implantation area. There may be injuries to the surrounding teeth. There could be nerve damage as well. Pain, numbness, tingling, feeling in the gums, mouth, chin, or neck area. Sinus problems, especially in the implants, are being placed in the upper jaw. The disadvantages are expensive, risk of screw loosening, risk of fixture failure, length of treatment time is more, need for multiple surgeries, and challenging aesthetics. Advantages: feels and chews like real teeth, doesn't alter neighboring teeth, completely secures after healing, no creams, no glues are needed, it is better for long-term oral health, looks identical to real teeth, and can be used for one tooth or several teeth. The success and failure. Now, this operation has 95% success rate. Though the success rate is high, this doesn't mean it doesn't fail. It sometimes fails also. So post-surgical patients must continue to properly take care of their teeth. The person's jaw must be strong enough to support the new artificial tooth. Those with type 2 diabetes might not be able to undertake this surgery because the lack of blood supply near the jaw is low. So what can be expected after dental implants? 95% dental implanting surgeries are successful. 5% are failure due to bone failing. Patients practicing bad habits lead to complications. Patients should visit their dentist 6 months after surgery to ensure that both the implant and the bone are healing correctly. The dentist will check other teeth so future implanting due to teeth decay is not needed. Patients need to use a special toothbrush or interdental brush. So in case of people who are habitual of smoking and they cannot quit smoking, they should use an electronic cigarette is encouraged, as this prevents smoke from damaging the implant area, and avoid hard chewing stuff. Thank you.